Thank you very much and welcome once again to our One Health Symposium. And it's about our One Health and Urban Transformation project where we are identifying risk, developing sustainable solutions to health. Today we are sharing with you our ideas from our projects in Ghana, focusing on One Health governance and health issues. It all started with the formulation of One Health policy. And how did it happen? There have been coordinated and multi-sectoral initiatives in Ghana to prevent diseases through the support of donor organizations in the past years. And in 2017, a One Health Technical Working Group was formed to develop a national policy for Ghana. And the focus of the One Health policy was on infectious diseases with particular focus on zoonosis. For example, 6 zoonotic diseases were prioritized, and they are avian influenza, rabies, hemorrhagic fevers, bovine tuberculosis, and trypanosomosis. Anthrax was the other disease. It was found out that cooperation among institutions has been reported as a major challenge hindering the implementation of the One Health policy. Today, the question we have today is how to translate the One Health policy into action and how to extend the One Health understanding in Ghana. And further, focusing on the expansion of the One Health understanding, then we need to acknowledge that much effort has been done in terms of the animal health, human health, but the environmental component of it has not been well captured in the framework. And in order to do this, there is the need for us to integrate the environmental component of health into the One Health policy. This can be done through land use planning, improved waste management systems, and the protection of surface water bodies. This is because environment is a great component that actually influence the emergence of diseases, either related to human or the animals. And in terms of environmental health, infectious diseases are very important. So there is the need to also include infectious diseases in the One Health governance policy in Ghana. Focusing on environment, it is important to acknowledge that the interactions between humans and animals within the environment is very complex, and these complexities are some of the issues that needs to be accurately tackled. Infectious diseases is one of the health challenges that we face today. And it was identified that these infectious diseases are linked to the environment, and the environmental health, also improving environmental health, is a strategy to tackle these infectious diseases. We had case studies of infectious diseases in Ghana, focusing on waterborne diseases and vector-borne diseases. And these diseases, again, were linked to the humans as well as the environment. And here we're talking about the biophysical environment and then the social environment, where human behavior plays an important role. In these pictures, we can see that the sections of the Odo River is highly polluted, and then also beside is also where we have the cattle raising area just along the river. These interactions between humans and environment exposes them to infectious diseases. For example, we're looking at the vector-borne disease as well as the waterborne diseases. Our study in Ghana, focusing on the human interactions with vector-borne diseases, identified that the incidence rate of malaria is still a huge health challenge in the Greater Accra metropolitan area. And this is linked to the interactions among different categories of factors, and again, which is about the physical environment and then the social environment, where we have the human behavior as well as the health-seeking behaviors. It was also found that one of the risk factors were the open ponds and pits that are existing in the area, which serve as breeding sites of mosquitoes in the area. Whilst compliance with malaria drug prescriptions and the adoption of preventive measures was also a problem in the area, because it was found that more than half of the people who actually receive the insecticide-treated nets actually do not use them. And this, again, has to link with the behavior of the people, looking at the social cultural factors influencing the usage of these bed nets. In order to tackle this problem of malaria incidence, there is the need to focus on reducing the density of mosquito vectors through regular drainage of breeding sites, as well as the use of larvicide to reduce the density of mosquitoes in the area. Our second case study, looking at the human interactions with surface water systems, identified that schistosomiasis is a huge health challenge among some school children in the peri-urban areas in Accra. And the risk and exposure factors were linked to limited access to safe drinking water and improved sanitation, increasing human-animal interactions through sharing of a common drinking water source, where humans and animals drink from the same unimproved sources of water from the river and then from the pond. This creates interactions where diseases can be transferred. Recreational activities, domestic and occupational water contact activities were identified as some of the exposure factors that exposes humans to the contaminated water body as well as the infested snail host. In order to tackle this disease, there is the need to provide wash for both humans and animals whilst discouraging open defecation. Collaborated and coordinated action campaigns for good health-seeking behaviors are required in order to reduce the exposure of humans and animals to the contaminated water bodies, and then also to break the transmission cycle of schistosomiasis, because it starts with humans, where humans get into contact with polluted water. This could be done through coordination of actions and also sensitization of the people, telling them the risk factors involved and also how to adapt health-seeking behaviors. Generally, it could be emphasized that integration of the environmental health component into the One Health policy in Ghana is crucial to tackling health problems, because whilst focusing on the environment, we can reduce the infectious diseases whilst having a trickle down or a positive return on promoting human health and then animal health, because the environment, including the physical and then the social environment, plays major roles in the disease emergence and transmission. So there's the need to integrate this integrate the environmental component into the One Health policy, focusing on promoting the environment and also implementation of land use plans, improved waste management systems, and then protecting surface water systems in the area. This together will improve the environmental health quality as well as the human health and then animal health. How can this be achieved? We need collaborated and coordinated actions that need to be implemented, need coordination, support, and also collaboration and support from the various sectors and various organizations in Ghana in order to bring this policy into action. Whilst we have talked about zoonotic diseases, looking at how One Health policy was formed in Ghana, we noticed that Ghana has advanced with the formulation of the One Health policy. Of course, it has not been implemented yet, but then it is important at the moment to zoom into some synergies between Ghana and India on the policy formulation and control of zoonotic diseases, because this will help the two countries to learn from each other on formulation of the policy and how to transform the policy into action. Yeah, thank you.